Okay, everybody, I am here prepping for surgery. I'm about to go in probably in less than half an hour here. I'm talking to my family on the video, but I'm going to be getting the hysterectomy, the bowel resection, and removing this endometrioma, and so I can have a fresh start. Hello, everybody. So I have been meaning to create this recovery or surgery video, but I just haven't been up in my desk, in my office at all. Chair is uncomfortable, so I'm going to do my update from my couch. So just a couple of pieces of advice for people who are getting ready to undergo this type of surgery. So for those who are new to this channel or this video selection, I had a hysterectomy and bilateral oophorectomy, which means they removed one ovary, and I also had a bowel resection at the same time for my surgery. So basically 2 surgeries in one, for endometriosis and also for Crohn's disease. This here, things that I'm buying for use at home for myself to be comfortable, to make sure that when I come back, I am able to restart, rejuvenate my digestive system. These items over here required by the doctor in order to prepare for the bowel resection portion of my surgery. And I'm also having the full hysterectomy, so I need to be ready. All right, I think the people are curious about what I'm taking in order to prepare my body. So based on my individual labs, I am optimizing my iron by taking this Pure Encapsulations Optiferrin C. I'm also taking zinc carnosine. I'm also taking curcuma supreme. And I'm also taking N-acetylcysteine. But remember, this is not medical advice. This is my personal experience. I just finished making my tea with this. I use collagen peptides, and I also use L-glutamine. And that is all to promote healthy gut healing once I am done with the surgery. I am, again, trying to make sure that my body has the best possible outcome of the surgery when it comes to healing. I also use this type of honey when I am making my tea these days. So I will give you some more details on recovery, what that looks like. But right now, I have been food-free, had to do a bowel prep, all that stuff last night, so everything can be emptied and sterilized. And now I'm just waiting for all the different doctors to come around and provide additional consent. My team is a team of 3 surgeons. So I will give you all a follow-up when I am out of surgery. Peace. So they marked my stomach with a couple X's of where they were intending to do the cuts, and then wheeled me back out there. I don't even remember going into the operating room. And then when I came out, you know, this is what you saw. The surgery lasted 8 full hours. So my family was a little bit worried because of the length of the surgery, but the doctors warned us that it would take a while just because of the depth of the work that they had to do. And I had the urologist there to put stents in to support the gynecologist, a surgeon, and then I had also a GI surgeon as well. So they had to work together as a team. I'm glad they did, because I am on my way to recovery. So when I get back out, hopefully everything goes well. I'll give you an idea of what the recovery is. Hello, y'all. So I did have a hard time the first day and the day of the surgery because of the anesthesia, and it was just, I mean, I was in excruciating pain. I couldn't get the pain to go away. It wasn't under control the first day or so, probably the first day or 2, because my oxygen levels and breathing rate was dropping so low, it kept going into critical, so they wouldn't give me too many narcotics because the anesthesia was affecting me more than they thought it would have. But after the second day, I was able to increase the medication, pain medication, and then also started to have better breathing rate and oxygen levels, so it went much better. All right, so I've had my surgery the day before yesterday, so I guess this is technically day 3 of recovery, and I am still in a little bit of pain. The first day was a whole lot of pain, trying to figure out which tools I could use for pain management. And now I'm just trying to use this to try to get my breathing back on par. Because for some reason, you know, after the surgery, and I think everyone has to do this, but it's just hard to inhale really deeply and painful sometimes when breathing. But I can feel that some of my organs are waking up from the anesthesia. Um, I still haven't gone to the restroom as far as number two is concerned, so that might take you all a while if you're going through surgery like this. But this is day 3 recovery. The pain is better than it was on day 1 and 2, but we're still working it out and just trying to just stay positive and stay relaxed so that I can have as little pain as possible, and really focusing on trying to make sure I can walk around so that I can ensure that my intestines, my digestive system is working again. So that's my goal for today, to walk around a little bit, obviously take this head scarf off and get ready and try to have a somewhat normal day where I'm out of this bed and I can sit in the chair or on the couch. All right, so in the hospital for day 3, and I will give you all an update on the next day or when I get out of here. So today is day 4 or 5. So I have my surgery on the 27th, and it is the 31st at this time. So I'm still dealing with pain. The pain has increased on the right side of my abdomen from the surgery, and now, interestingly, there's some abnormal discharge that I'm having from the surgery that the doctors need to look into. And my main concern is making sure that there's no infection, that there's been no leakage or anything from one of the surgical sites at all. So that's just one of the things that I'm trying to work on at this time. And at this point, it's still pretty bad, but I'm hoping that things will be much better after I get out of the hospital, and then continue improving drastically once I get home. So that is my update for today. I did do a couple of walks today. Oh no, that was yesterday I did a walk. And today I did one walk halfway down the hallway. And so the doctors want me to walk more, to try the breathing treatment multiple times, like every hour. And so I'm going to be focusing on those things to help loosen up the mucus that's in my lungs and chest after being under anesthesia for a while. Your lungs get a little lazy. So those are the things I'm working on for today. All right, thanks for watching. All right, it's the end of day 6 in the hospital, and I'm finally getting ready to wrap out. Got my pillow here, and I took my incisions and rings from Pride, and I hope it's a easy one. All right, an update on the hospital. I ended up staying in the hospital for a full week. While it was not great to be there, I'm glad that they were taking, precaution and checking things out and following up. I was pleased with my care team while I was in the hospital, so that was good. But what they did for that surgery was the hysterectomy. Of course, they removed the full uterus and cervix, and then for the oophorectomy, I had a large endometrioma, so they removed that and also my right ovary, and I was left with my left ovary. The doctor cleared the endometriosis from around that ovary and spared the left ovary so that I wouldn't go through immediate menopause. And then she put me on some hormone replacement therapy to kind of help with the add back, so that I'll keep my estrogen level low enough that I don't have any more endometriosis issues. Now with the bowel resection, they ended up doing a couple of different types of cuts there. So laparoscopic for the first part, but then because of the adhesions and scar tissue that I had from previous surgery, I had to have an open cut as well. So I did have quite a bit done in my abdomen there. So my recovery is a little bit longer than what people might hear if they were just going to undergo one or the other. So my recovery time, rather than being 4 weeks, is probably more around 8 weeks to recover. So with the bowel resection, this is not the first one I've had, but the doctor took out the part of the intestine that continues to have the Crohn's disease that's been scarred also from the previous surgery. The site of anastomosis is what they call it, because the disease continues to recur in the same spot for me, and it was putting a lot of pressure there, and pretty soon it would have basically developed some sort of hole in that area. And then with the scarring and the intestines that were stuck together, she kind of made sure to pull all those pieces apart, and then she sewed up where there were any weaknesses in my intestine, and the small intestine is where that mostly was done, and then she patched me back up. I couldn't keep a lot of food down for quite some time, so I was on a liquid diet for a while, and then I went to a soft diet, and then when I came home, I was still on a soft diet. So now fast forward, and I have a lot of stairs, So I had to, get up the stairs, and I had to get like these step stool things to help me so that I can get into my bed. My bed is really high, just in order not to pull things. So if you have this surgery, then what you're going to end up doing is getting a lot of instruction about relaxing, not moving too much so as to pull, your stitches. For me, I had the glue on my skin on the outside, stitches, and then I also had titanium staples inside, for the intestinal piece. And then for the laparoscopic portion, they didn't have to do much. I did end up getting a surgical procedure to kind of sew up the internal piece, since I don't have a cervix anymore. And if you're looking to understand what that's called a vaginal cuff, and that's what's created when you have a full hysterectomy in order to keep everything in order. Now, you do have ligaments and things like that that are attached to your ovaries and your uterus and all that. So the doctor, of course, has to place those into the right location and then get things back together so that you still have some support and stability. So that was all taken care of. And with the resection, she just put the two healthy sections of bowel together, stapled them with titanium staples, and got everything ready to go. So I ended up with a scar across my belly. I have an address now, so I can't show it, but a scar across the lower right, going from, my belly button all the way out to the right. I guess it's probably about 6 inches over an old scar from another surgery. And then I have a belly button scar, and then I have a scar in my upper left, and then I have a scar lower left as well. Most of the work was done on my right side though. When I got home, I was just ensuring that I had things like Gas-X, and I had peppermint tea, which I actually brought to the hospital with me. I did lots of bone broth. The Gas-X, I was looking at other videos and they were like, your gas is going to be terrible and can be very painful. So I wanted to make sure I had that on hand, and it did help. The medications they gave me to take after surgery when I came home, I do not like taking medication that makes me feel out of it or dizzy or anything like that, but they gave me the oxycodone to come home with, which helped. I could not take ibuprofen, and I can't because it causes, bleeding for me. I do have, I'm prone to ulcers, have that as well. And I have the gastroesophageal reflux, but those things are really controlled with my diet and lifestyle. So I really don't have a lot of problems with those things. They also gave me something called Flexeril and what's the other one? I can't think of it right now. Oh, and gabapentin. So those things together helps control my pain, plus Tylenol. And then if you have problems with, restroom use as far as stools being too hard, there's also Senna, and then they have given me Miralax. I didn't need to take those things. No, I take that back. I did have to take the Senna when I was taking the oxycodone. And by the time I was at the second week home, I did not have to, a second week after surgery, not home, I didn't have to take the oxycodone. And I just continued to take the Tylenol and the Flexeril and the gabapentin. So those things were really helpful. Some other things that helped me at home, just knowing that I needed to sit down and relax, right? You're not going to be able to get up and just do some things, even if you feel like you may have the ability to do it. Once you start, the pain pills kick in, you may feel like, oh, I can do something, but then you will surprise yourself and end up, you'll end up hurting yourself and be back to square one. So the main thing after the surgery that I've learned is to sit back, relax, get up, walk around a lot so that I can make sure that there are no blood clots and things like that. Of course, at the doctor's office, they gave me shots to prevent this, but when I got home, I was not on that. So I wanted to make sure that I was continuing to keep up some sort of physical regimen that was enough to keep things circulating as well. And then my problem is I get startled sometimes and I end up stretching. I didn't realize how much my core was a part of every single movement. So I started to have back pain and all that from just not having the movement. And then I also had to be careful because I don't sleep on my back naturally. I naturally sleep on my side. And so those are some things you have to just be prepared for. I have a video in here that shows just all the things that I brought home with me. A bunch of loose clothing. I did buy the nylon extra stretchy underpants that you can get on Amazon that are just like the ones at the hospital, because I couldn't have anything over my belly because I have because of how low the other cut was. So that's something you might want to do. You may want to make sure that you have, of course, loose clothing, lots of things that you can drink, fluids, liquids. Don't get dehydrated. You don't want to just stay sitting, of course, right? You want to kind of recline, and you also want to lay flat. So the doctors told me to lay flat to help with the healing process, that it will help things to, one, it will help me to be able to stand up straight when I would walk, just continuing to just lay flat on my back rather than always being kind of scrunched up a lot. And then I found that it did help. I was able to stand upright sooner rather than later, even when I had the pain, because I was just getting used to staying stretched out. And also I think because I have the staples rather than sutures, I think they were stronger. And so when I did things like sneeze, of course you need to hold a pillow of, across your belly when you sneeze, but it didn't, I thought one time I thought I sneezed so hard, I thought like for sure a stitch has come loose. But the titanium staples are very strong. Nothing happened. It was just, uncomfortable discomfort. But just be very careful with things like that. Go shopping, okay? Make sure you have lots of foods that are easy to digest outside of just liquids, because you will be eating. If you're having a bowel resection, you definitely want to start so easy on the foods, easy to digest. Just the wrong ounce of the wrong food can send you over the edge. For me, I think it was green beans. They said I could eat cooked vegetables, so I had green beans at the hospital. I was immediately sick, completely nauseous, stomach pains from food trying to digest. It was terrible. So if you have a bowel resection, you really need to be on a soft diet for a longer time than you think. The hysterectomy by itself, you can probably start eating a regular diet. But if you have endometriosis and they have to scrape it from your bowel, they have to do a resection. If there's lesions, you are going to have to start on a very soft diet. All right. And work your way up from there. Keep your appointments. I had a post-op appointment, and then I will have another post-op appointment to check the vaginal cuff that was created 6 weeks out from the surgery date. So that's a while from now. And then I'll have another appointment again with my GI surgeon, and then I have another appointment again with my GI doctor. And I'm also continuing Skyrizi even after the surgery. So I just took that today, actually. So I use the on-body injector for Skyrizi. The Skyrizi is actually working for me. The reason I had so many issues with the Crohn's and did the bowel resection and all that is because I had the endometriosis on top of the Crohn's, and the spot continued to be inflamed, and because I had such bad scarring, it led to lots of pain and inflammation and all that. So a lot of my problems, like additional symptoms that I was having with the Crohn's, once they removed that from this, after the surgery, once those spots were removed, I noticed that a lot of my other symptoms disappeared. So I'm dealing with the pain from the surgery, but not dealing with the pain from the Crohn's. So still having pain when I, do number 1 or number 2, but it's a different type of pain. I can tell that it's from the pressing from the surgery versus the pain that I just have to use the restroom, and it's terrible. So I'm looking forward to finishing this recovery process and just getting back to, not even back to normal, getting back to a better state of normal for myself. I don't know, if you all have questions about this surgery, please ask them in the comments. So if you have a question about what this surgery entailed, what the doctors told me to do, anything like that, please feel free to put it in the comments. And if you are going through something like this, be assured that there is a light at the end of the tunnel. It may be a painful process. You may have to ask all the questions you need to ask your doctors. Trust your body. If you feel that there's a problem while you're in the hospital, speak up on it. I'm going to tell you one thing also: when the doctors are giving you medications, make sure you pay attention to what they look like. I did have an incident, and nurses are working 12-hour shifts now, you all. I don't like it. I don't agree with it. I think an 8-hour shift is much more feasible and humane, because when you have exhaustion happen, then you can have mistakes happen. So I had one of the nurses gave me 2 pills. Now these weren't life-threatening pills, but I looked at it, I was like, these are not the 2 pills I'm supposed to take at this time. And he was like, ooh, I'm so sorry, those are not the right ones. So that could have easily been a mistake that could have been detrimental to my health. And for some people, it has been detrimental to their health. And remember, hospitals are going to protect themselves. If you're in the hospital and they're giving you medication, have someone there with you that knows what you're supposed to take, and you look at the pills yourself so that you know what they look like. So if you get something, you're like, wait, this doesn't look like the one that I'm supposed to have at this time, you can make it known, because there's no need to go in the hospital for something small or whatever, and end up not making it out because of a medication mistake. It happens. And I learned when I went to pharmacy college that a lot of the mistakes and the cause of death that's really high up there on the list are medication mishaps, but they don't want that published for you. So that's just a little note for me to you. Pay attention to what you're taking when you're in the hospital. Yes, the nurses are knowledgeable, and yes, they will be helpful and take care of you. However, they are exhausted, and they're human, and they make mistakes. And not every nurse was supposed to be a nurse, if you know what I'm saying. Okay, so, all right. If you have questions, feel free to reach out. Thank you all so much for watching, and I shall talk to you soon.